Hello everyone. Welcome back to another session of Educators. We are going through the different discussion on the diet during pregnancy, and we have discussed about the proximate principles of food. And today we are going to discuss the importance of different minerals in the diet during pregnancy. So let us start. The first and the foremost important mineral that we need to talk about is calcium. We all know the need of calcium during pregnancy because during pregnancy the uh, normal fetal skeleton they has accredited about 30 gram of calcium at the end of gestation, and during the third trimester this accretion rises about 80%. So during pregnancy, generally, the requirement, which was previously, according to RDA 2010, 600 milligram, was doubled to 1200 milligram to support the skeletal growth of the child, and to also to balance the changes of a mother. Now, the extra 400 grams of milk for veg mother and 200 grams of milk for non-veg mother, which is extra given during this pregnancy, has to be given to provide this growth. Basically, the ratio of calcium and phosphorus in milk is just apt for the growth and development of the mother, not the mother, actually development of the child through the mother. And also this milk provides the required amount of magnesium which is needed by the body of the mother. But now what is happening, we can see the normal requirement, which was according to the RD 2010, was 600 milligram, which the rise was about 1200 milligram, like 600 milligram of rice was there, but now there has been given a proper calcium requirement of 1000 milligram continuously. So a normal woman who is taking 1000 milligram of calcium throughout will generally and gradually develop the calcium required. So this extra rise, which is just double, which was there in 2010, is not shown in 2020 RDA. So now 1000 milligram of calcium is given to normal women and also to pregnant women, which actually builds a gap of this 600 milligram. This extra 400 milligram has been given throughout the womanhood, because the mother requires to maintain the calcium in their body too, and not only extra during the pregnancy. Now, why do we need this calcium, and how can we maintain this calcium? Definitely, the fetus is growing, so whatever demand, extra demand we need for pregnancy is due to the extra the growth of the fetus, especially during the third trimester. And also there are different physiological compensation needed because there are too much changes in the hormone levels. That leads to what? The intestinal absorption of calcium has to be increased, and the renal calcium loss has to be decreased. So if we can increase the intestinal absorption of calcium and we can decrease the renal calcium loss, there only we can maintain the calcium balance of our body. So intestinal calcium, how, what are the features? Intestinal absorption of calcium is double during pregnancy, and they are, how they are doubling? Because of the doubling of this 1,25 dihydroxy vitamin D levels. This level they double which actually results in the doubling of the intestinal absorption of the calcium during pregnancy. Now, when there is increased intestinal expression of the vitamin D, the calcium binding protein that also increases. And what happens? The renal calcium excretion that decreases. Now we have to understand that yes, intestinal calcium absorption is the primary source, because if we are not giving the intestinal calcium absorption, if there is no calcium in the food or via supplementation, then the mother's teeth, mother's bone will be at stake. Also, we have to keep in mind that when we are giving them intestinal calcium, there should not be fiber and fat, because they binds the calcium, and the soluble pectin fiber, they binds the calcium, and the fat also, they binds the calcium and forms a soap in this case. Now also something has to be taken care of when we are actually giving some calcium rich food. What? The oxalates and the phytates. So rice bran, wheats, rhubarbs, spinach, which are very good for the mother, the almonds, which are very good for the mother, but they contains oxalates. So when we are actually given calcium rich food for to the mother, so we are trying to increase the intestinal absorption, we will not include that with foods like this and this containing oxalates and phytates, because they try to bind the calcium, available calcium, and the calcium which was supposed to be absorbed by the mother's body is not absorbed. So where do we get the good amount of calcium? From ragi. This is the quantity, and the calcium content has been given. Horse gram, colocasia, amaranth, methi, curry leaves, almonds. But again, when we are giving almonds, we can see that in almond both oxalates and phytates are there. So we have to take care of that. Definitely milk and milk products, and some kind of fish like this. So we have to include the diet in such a manner. When we are giving a day's diet, we have to include these foods in such a manner, so that we need to formulate the uh, food in such a manner that the calcium is absorbed and it is free from oxalates and phytates. Okay, and as you know that this is the millet year, so government has declared this as a millet year. And also remember that ragi is a very good source of, has a very good source of calcium, is a very good source of calcium, and can be given to mother and also children as a good cereal. Now coming to magnesia and pregnancy. So magnesium is also very much required during pregnancy. So what happens if there is hypomagnesia? What do you mean by the term hypomagnesia? Hypo means less. So when there is less magnesium in your body, then what happens? The preterm birth, that incidence is increased. There can be a chance of spontaneous abortion. The calf muscles cramp are there. There are increased risk of pre-eclampsia, and sometimes the low postpartum magnesium levels are associated with type 2 diabetes mellitus. So calcium and magnesium are very much important for our body. So what do we need to do? So every pregnant woman should be supplemented with around 370 to 440 milligram of magnesium, and they should start as soon as the pregnancy is confirmed and continue till delivery. So definitely this has to be given, because calcium and magnesium should come hand in hand. And if there are multiple birth like twins or something like that, then the requirement has to be higher. When there is lactation, this demand increases definitely. But um, magnesium has to be given, and that too in this amount. So which, through food, what we can do, how can we include foods like seeds, like rather pumpkin seeds, almonds, spinach, dark chocolates, bananas, avocados, oatmeal, quinoa. These are good sources. And again, keep in mind that almonds has both phytates and oxalates. So how we have to give, but how we will give and when we will give, that is important. So it will be given, but the timing, the moderation has to be done. Okay. So peanut butter, black beans, shredded wheat cereals, peanuts, these are all good sources of magnesium. So a proper balanced diet containing all these foods has to be given, so that uh, magnesium is properly given to the mother. So now we will be discussing about the most important mineral after calcium, that is iron. Now why iron is the most important? Because it is the most deficient mineral seen in every woman. Every girl, every woman has a deficient iron, more or less. Okay. So if you can see this bar diagram over here, it is showing the prevalence of anemia in South Asia. Okay, South Asian countries. This is a very much blurred and it is very little, so I think you can't see it properly, but I'll just discuss. So these are the different South Asian countries over here shown, and the one with the highest bar graph is India. India is, you can see, the anemia capital of the South Asia. Okay, and South Asian countries, among the South Asian countries, India has the highest anemia. Now why this anemia is there? Why? So what do you think? Because a healthy mother will give rise to a healthy child, and like that, an anemic mother will again give rise to an anemic child, and this vicious cycle goes on and on. So let us discuss this vicious cycle to understand that how anemia moves on and on. Like first, poverty and malnutrition, this is the first thing. Like yes, any kind of poverty leads to malnutrition. Again, malnutrition can be there not only due to poverty. It is not like that due to poverty. Malnutrition, as we know, is of two types: undernutrition and overnutrition. Okay, so when there is malnutrition, one of the reason is definitely poverty. Another reason, which is very important reason, is lack of knowledge. That means I have the thing, I know, I don't know that this thing is rich in iron, and I don't know how to take it. So that is very much important. So I must know what is there, how much iron is it there, and how to take it. So that is very much important. Along with that, we have that leads to early marriages and poor spacing. Now early marriages is a thing where the women body is not prepared only for a child, and we are getting pregnant. So in that case, all the nutrients that should be passing from the mother to the child is not there. The child is not getting enough nutrient from the mother. But when we're talking about poor spacing, what happened? You have given everything of yours to a child. The child is healthy, the child has born. Now you also need some time to recover, and you have not given yourself that time to recover. So what will happen? The next child that will form will be definitely deficient in any of the vitamins or minerals. Why? Because you are not ready. So poor spacing is a very important cause of any kind of malnutrition, especially anemia. Now, education and gender bias. Education example I gave you. Now, gender bias. The best piece will go to my boy, my son. The best thing will go to my son. The best education will go to my son. So nowadays we are in this century, but still this thing persists, that this gender bias is there. So we have to come out of it, because all these things lead to anemic mother. And when the mother is anemic, that means the reserve of the mother, the iron reserve of the mother is not there properly. The child that will born, that reserve will also be anemic. And along with that, due to unhealthy lifestyle or something like that, parasite infestations can be there, leading to more anemia, more poverty, more malnutrition. So during a reproductive career, not only during the reproductive career, a women can, an anemic girl can grown up to an anemic lady, anemic mother, again give birth to an anemic child, which can go up to an anemic lady, anemic mother. So this is a vicious cycle which goes on and on. So if a mother knows that yes, I am anemic, so it's the duty of the mother and the healthcare and the family to stop that, so that the generation after, the next generation, can stop this vicious cycle and come out of this vicious cycle, and that can be of great help. So pregnant women, rapidly growing infants, they are vulnerable to iron deficiency, and they are substantially, iron is lost from the body, and definitely they are at risk of different iron deficiency. How can we understand that we have iron deficiency anemia? Fatigue, tiredness, shortness of breath, hair loss, headaches, leg cramps, depressions, etc. So we need to actually focus on the vicious cycle and stop that. Now government is now helping a lot. Okay. So iron rich food has to be given, and along with that, iron supplements which is provided by the government, the IFA tablets, iron folifer, has to be given to the pregnant mother. As you can see this chart, this is from a government thing, like when and what to examine, and do's and don'ts. Like you can't take the IFA tablet and the calcium tablets together. You can't take, okay? And you should not take the IFA tablets, the red one are the IFA tablets. IFA tablets, iron folifer tablets are always red tablets. Those who can't understand, those who are not educated, we can tell them that these are the red tablets which you have to take, and how you have to take, that has to be told too, that with this calcium tablets you will not take, with tea and coffee with not take. Okay, so with tea and coffee we will not take this IFA tablet. So how can we take the IFA tablets? IFA tablets can be taken with lemon water. Why with lemon water? IV tablets can be taken with lemon water because vitamin C helps in iron absorption. So if you have taken iron tablet, IFA tablet, and after that we have taken a glass of lemon water. It will help in the absorption of the iron. Okay. Along with that, green leafy vegetables, meat, fish, vitamin C rich foods, which will help again definitely for the absorption of iron, and sprouted pulse, which are also rich sources of vitamin B and vitamin C, has to be given to the mother. And that guidance has to be given from the government and from the health professionals, from the dietitian, from the nutritionists to the pregnant mother. The hemoglobin testing and the paleness, the normal paleness of the eyes, skins, nails, tongues has to be checked. So that has to be given. Now, previously, a non-pregnant woman was given 20, previously means according to RDA 2010. Non-pregnant woman was given iron of about 21 milligram during pregnancy, which was rise to about 35 milligram. But now generally and normally it is 29 milligram. That means in calcium also we have seen, in iron also we are seeing that these two are regularly needed by each and every woman, calcium and iron. So the regular intake has been increased, but not only during pregnancy but also the daily intake has to be increased so that the store of the minerals increases, the base forms. We are actually thinking about the base to form. Okay. So now, like according to RD 2020, 29 milligram is generally given to a normal women throughout the life. Along with that, during pregnancy it has been reduced to 27 milligram. Along with that, IFA tablet, IFA means iron. Along with that, elemental iron, that is 30 to 60 milligram of elemental iron, and 400 mg of folic acid. It's a combined form. It is given to pregnant women. Generally it helps in the maternal anemia, puerperal sepsis, which is a vaginal infection, low birth weight, and preterm birth. So it's very serious, and we need to focus on the diet, as well as we need to educate them that how to take this um, tablets, supplements. Okay. So these are some iron rich foods, and along with iron rich foods, some vitamin C rich foods always has to be combined, because that will actually help in the iron absorption. Um, if you're talking about a low cost iron rich food, then any kind of oysters, like googly in Bengali that we say, clams, that can be definitely given to a pregnant mother. The consumption of that is very good for a pregnant mother because it is also rich in iron. And for a rich source, you can give dried fruits, red meat, like especially the liver. You can give any kind of oysters, shellfish, that can be given. Along with that, egg yolks, eggs can be given. Along with that, definitely it has to accompany with vitamin C, especially citrus fruits and sprouted cereals. Okay. Folic acid, though it's vitamin, but as it is in combination with the iron, I have attached this over here. It is very, very important. It helps, it's a super vitamin, we say. It helps in the DNA replication, vitamin metabolism, RBC production, also baby's neural development. So DNA replication, and if there is improper baby's neural development, if there is deficiency of this vitamin, neural tube defects can be seen, low white blood cells and platelets can be seen, and even megaloblastic anemia can result if there is a folic acid deficiency. So definitely iron and folifer has to be given, but folate has to be given. Folate are mainly if there is a folate deficiency, complications like spina bifida, anencephaly, cleft lip, premature birth, these kind of miscarriages, these are the problems. So the recommendations I've already discussed, that has to be given. Folate rich diet includes orange, tomato, cereals, cabbage, bread, chickpeas, kiwi, collard. This is a kind of a leafy vegetables, spinach. So any kind of leafy vegetable, again peas, red beans, peas, leafy vegetables has to be given. Always try to understand that if we can germinate some of these peas and beans, it is better for them. The sprouts that we see, it's better for the absorption of the folate as well. Coming to another very important mineral, that is zinc, and it mainly helps in the construction of baby cell and DNA during pregnancy. So when the baby grow, there is cell division, right? So and also there is tissue growth. So that is where zinc is required, because the zinc helps in the building of this the trillions of cells that is formed. Okay, and it also helps in the normal brain functions, and also uh, later on when the baby is associated with the future learnings and the development, immune system, all these things are actually built up by the zinc through the mother. So zinc intake is also very very much important um, for the mother to take. So around 13.2 milligram per day to 14.5 milligram per day zinc is asked for the mother to take for the baby's diet in a healthy, balanced pregnancy diet. Now, what actually zinc does, you can see that if there is any problem in the zinc homeostasis, that means if zinc level goes down, then even there is, I told you that zinc helps in the cell division of the baby. So, definitely, if zinc is not there, then growth restriction will be there, and growth restriction will result in the outcome of pregnancy. Even fetal death can be there. And zinc is also associated with preeclampsia, and this is so that has to be checked. So zinc is generally transported via the across the placenta via the active transport from the mother to fetus. So if the mother is actually having good amount of zinc, that can be transported to the fetus in itself, and that maintains the zinc homeostasis. Okay, and the amniotic fluid, they also have the zinc concentrations, which will also help in the delivery. So during the 33 to 36 weeks of gestation, this uh, zinc homeostasis is sometimes imbalance, so that has to be maintained. So oysters, red meat, spinach, almonds, chicken, cashew, any kind of grass fed dairy, like when the cows are generally grass fed, that kind of a dairy, these are good foods. Cocoa, they are good foods, high in zinc. So a balanced diet has to be given with these. Like you can see that in everything, when we are going through the diet, pumpkin seeds and almonds, spinach, red meat, chicken, oysters, these are there. So a diet which is balanced, which can be given in each and everything, we can actually can incorporate each and everything. So we told that around the some amount. So how much oatmeal, like if you are giving a bowl of thing, 2.9 milligram per cup, peanut butter as 0.5 milligram. So total pistachio have something, lentils, any kind of fortified cereals, they have good amount of zinc. So zinc has to be given to the pregnant diet as well. Now iodine, which is again another very important mineral, because you know that it is an ongoing challenge, as it is also mentioned here. And baby's brain development, it is very essential for that. It is seen, according to CDC report, that women have lower levels of iodine than men, and generally during the age group of women, when they get pregnant, they have a lower levels of iodine. Um, so iodine deficiency leads to intellectual disability as well. Why do we need iodine? What happens in iodine deficiency during gestation? During the first trimester, if there is iodine deficiency, uh, thyroid volume increases, gestational diabetes mellitus can be there. There is placental abruption leading to spontaneous miscarriage, hypertension, oxidative stress increases. In second trimester, the thyroid volume increased, prematurity, iron deficiency, anemia, preeclampsia, fetal growth restriction. Third trimester, small for dead baby, eclampsia, low birth weight baby, and there can be nodules in the thyroid and thyroid volume problem. So, what do we need to do? Definitely iodized salt, low fat dairy products, seafoods can be given. Along with that, cords. We don't get cords over here, but yes, nowadays cranberries are definitely a source. Milk, definitely we can give. Turkeys, boiled eggs are good sources of iodine. Cheese are good sources of iodine. So a balanced um cheese consumption, milk consumption, um, egg has to be given to the mother. Okay. Selenium. Selenium is also a micromineral, but it has a huge function in your body. It is a potential antioxidant, and it actually helps the egg development and also protects the embryo from free radical damages. Generally, a normal women or adults, we can say men and women, they require about 55 microgram of selenium, but a pregnant woman requires around 60 microgram, which increases for lactating women to about 70 microgram. It is rich in seafoods, eggs, garlic, and onion families, broccolis, etc. So, how can we include selenium in diet? Like nuts, especially Brazil nuts, they have good amount, and seeds, 1/4 cup, with that yogurt, that gives a meal, that gives a complete, milk in yogurt. They gives a 19 mcg microgram of selenium. That's a good source. Again, you can give a proper diet like fish and proper herbs. That also gives you about 40 to 60 gram of microgram, which can, a proper meal can give you uh, complete source of the selenium that is that is required for you, for the baby. And so seafoods, whole grains, eggs, these are good sources of selenium. So when we will be discussing about the different the food that can be given a balanced diet, when we planning, we have to keep everything in mind, all these little things in mind, and then we have to think about the diet of the pregnant women. In the next video, we'll be discussing about the important vitamins that is required for the pregnant mother. So I hope you like the video. That's all for today. Thank you so much.